My name is Stephanie Hansen, and I'm an RN and Quality Improvement Advisor for Great Plains Quality Innovation Network, and I'm talking with you today about Medicare annual wellness visits. Medicare offers three different opportunities for wellness visits. The initial preventative physical exam, IPPE, only happens once when someone is new to Medicare, and it must occur within 12 months of starting Part B coverage. The annual wellness visit can be completed every 12 months, and this visit is intended to develop or update a personalized prevention plan and perform a health risk assessment. The routine physical exam are important when a person is having a specific issue. Physical exams are related to medical necessity. One thing to note is that the need for a physical exam could be identified during the annual wellness visit. Today, I want to focus on the annual wellness visit. Before diving into the Medicare annual wellness visit components, we wanted to share some data. When looking at Medicare fee-for-service claims data, we looked at it across the Great Plains Quinn Community Coalitions. You can see them here on these two maps. There are 5 in each state, and they are defined by geographical service areas or zip codes. We looked at Medicare fee-for-service beneficiaries who live in these communities to see if they had received a Medicare annual wellness visit. The data showed us that the Medicare annual wellness visit is in fact an underutilized Medicare Part B service. From the 1-year period of April 1st, 2023 to March 31st, 2024, the best performing community was at a utilization rate of 29.39%, and some communities' performances rates were as low as 4.25%. Each community has a different utilization rate. Overall, the utilization is very low in both states. We encourage you to look at your own internal information to see what your organization's utilization rates are and start putting some thought around how can you improve them. Let's talk more about the actual annual wellness visit. The first thing to note is that there are different components to the annual wellness visit depending on if the visit is a beneficiary's first visit or a subsequent visit. A nice tool that spells out these components is the MLN Educational Tool on Medicare Wellness Visits. You can find the link to this on our resource slide. The resource also explains coding, diagnosis, and billing details for the assessment, as well as the 2 optional elements, advanced care planning and social determinants of health risk assessment. As I stated, there are different components to the annual wellness visit depending on if it is the initial or subsequent visit. This table shows you side by side the difference between the two. It is broken into 3 sections. The first is acquiring beneficiary information. Second, beginning the assessment and then counseling the beneficiary. We will notice the majority of the visits is spent on acquiring information and counseling the beneficiary. We are going to walk through each of the components at a high level. Acquiring beneficiary information. The components included are performing a health risk assessment. CMS provides what should be collected at a minimum. This includes information like demographic data, a health status self-assessment, life satisfaction, stress, loneliness, tobacco use, nutrition and oral health, alcohol consumption, self-assessment on activities of daily living. Next, establish a list of current providers, making sure to include those providers who provide medical care as well as behavioral health care, making sure to get that holistic picture of who is taking care of your patient. Then, establishing a medical and family history. Review potential depression risk factors. Make sure to select a tool from various standardized screening tools designed for this purpose. You will also want to review the beneficiary's functional ability and level of safety. This includes using direct observation as well as appropriate screening questions to gain insight into their ability to perform activities of daily living, fall risk, hearing impairment, home and community safety, including driving when appropriate. And if at the discretion of the beneficiary and provider, the administration of a social determinants of health risk assessment. This is a new element that has been added to the annual wellness visit, and we will talk about a little bit more about that later. In the begin assessment section, the components include obtaining measurements. In the initial annual wellness visit, these include height, weight, body mass index, and a blood pressure. Detection of cognitive impairment. Here, the provider is assessing cognitive function by direct observation or reported observations from the patient, family, friends, caregivers, and others. You can consider using brief cognitive tests, health disparities, chronic conditions, and other factors to contribute to increased cognitive impairment risk. And for the counseling beneficiary section, the components include review current opioid prescriptions. For patients with a current opioid prescription, review any potential opioid use disorder risk factors, evaluate their pain severity and current treatment plan, provide information about non-opioid treatment options, and refer to a specialist as appropriate. Screen for potential substance use disorders. Review the patient's potential substance use disorders risk factors and, as appropriate, refer them to treatment. Establish an appropriate patient written screening schedule. This needs to be based on the checklist for the next 5 to 10 years, USPSTF and ACIP recommendations, and the patient's HRA, health status and screening history, and age-appropriate preventative services. Establishing a list of risk factors and conditions for which interventions are recommended or underway, such as identifying if the patient has diabetes with an elevated A1C, so referring to a diabetes educator. Provide personalized health advice and appropriate referrals. These referrals can include educational and counseling services or programs aimed at fall prevention, nutrition, physical activity, tobacco use cessation, social engagement, weight loss, or cognition. And finally, at the patient's discretion, provide advanced care planning services. This is a discussion between the patient and the provider about preparing an advance directive, discussing future care decisions, and how they can let others know about their care preferences. When looking at the components of the initial annual wellness visit and the subsequent, the main difference is that you are moving from establishing many of these components to updating them. You can review this table for the exact differences. Last thing to note is that both the social determinants of health risk assessment and the advanced care planning services are in red on this table. That is because they are both optional elements to the annual wellness visit. Both of these are completed at the patient's discretion, and the social determinants of health risk assessment is done at the provider's discretion as well. They both have special coding, diagnosis, and billing guidance attached to them. I encourage you to check out the MLN Medicare Wellness Visit page for those details. The social determinants of risk assessment is a new optional element to the annual wellness visit. With a new element comes new coding, diagnosis, and billing guidance. As I stated, you can find the full details of this on the MLN resource, but we wanted to highlight a few. This assessment, as I've stated, is done at the provider and patient's discretion. It helps to assess patients' risk and guide medical decisions making, prevention, diagnosis, care, and treatment. A new HCPCS code G0136 was made available on January 1st, 2024 to file social determinants of health risk assessment claims. You can see the description of this code here. Additional guidance for billing will go into effect on October 7th, 2024. Refer to resources for further guidance on coding, diagnosis, and billing. Please see the MLN website for Medicare annual wellness visits or reach out to Noridian Healthcare Solutions, your Medicare administrative contractor. The links to these resources can be found at the end of this presentation. Noridian Healthcare Solutions has a detailed webinar where they covered the Medicare annual wellness visits, which includes the social determinants of health assessment. That is very helpful as well. Again, all of these links are on our resource slide. Only 20% of an individual's health is tied to clinical care. 80% of an individual's health is tied to their physical environment, social determinants, and behavioral factors. Given the large impact of each of these, you can see why it was important for CMS to add the social determinants of health risk assessment to the annual wellness visit. If you are a practice that has annual wellness visits in place, this is a nice way to work in the social determinants of health screening into your workflow. Having the coding and billing available for this assessment allows you to take credit for the work that you are doing while setting your patients up for success when they leave. Here are a few links to some social determinants of health screening tools for you to see what you prefer to use. They all have their pros and cons. Some are translated into several languages, written at different reading levels. Some have a few questions, some have many. You just have to find what works best for your practice. The Prepare tool has been a popular tool that many clinics have used. The second is the Accountability Health Community's Health-Related Social Needs Screening Tool. This one is created by CMS and the Center for Medicare and Medicaid Innovation. The nice thing about this tool is it assesses on each of the health-related social needs that CMS is measuring in different quality programs. The third link is to Social Interventions Resource and Evaluation Network Comparison. This is a nice spreadsheet that compares several different screeners so you can truly select the tool that is best for your practice. We have talked through different components of what the annual wellness visits are. This image maps those components onto a suggested workflow. This is an example of how conducting an annual wellness visit could look in your facility. The components of the annual wellness visit are allocated to different staff members based on their ability and expertise. This flow can help visualize how the annual wellness visit process is not the sole responsibility of the provider, but how it needs to be shared by the team. There are several examples and different resources out there. You just need to find what works best for your team and the patients you serve. Thank you for taking the time to learn a little bit about the Medicare annual wellness visit. This is intended to be a quick overview. We know that there are a lot of logistics and considerations when it comes to implementation. Please utilize the resources we have shared or feel free to reach out to Great Plains Quinn for additional assistance. Some key takeaways are that the annual wellness visit really is a key component of preventative health care. There is a lot of value in these visits and conversations. The annual wellness visit was created by CMS as a benefit to Part B patients and is a great tool for care coordination to improve patient health outcomes. There is an opportunity for annual wellness visits in North Dakota and South Dakota. The Social Determinants of Health Risk Assessment is a new optional element and will be covered annually starting on October 7th, 2024. And lastly, Implementing the annual wellness visit takes the whole team. Finally, here are the resources I have referenced throughout. This is an image of one of the resources on the previous slide. This is a printable document with a suggested workflow on the back side. Please utilize this document and take to your leadership or staff to start the conversation around Medicare annual wellness visits in your organization. You can contact a member of the Great Plains Quinn team. Here is my contact info. We are here to help, so reach out now or reach out anytime. Thanks again for joining us and have a great day.